I don't have to put a mic on. Do I need? What? What? Left? Um, who am I looking at? I need a person. There we go. I can look at you. That works for me. All right, so I don't have a prepared statement today. So Martha Buchanan, Martha Buchanan, MD, I'm the director of the Knox County Health Department.
Dr. Buchanan, we've heard a lot about testing in the past few days. The governor's saying that he's working on 15 test sites rolling out across the state. What can you tell us about those potentially coming to Knox County?
What I can say about testing here in Knox County is right now our medical providers are working on increasing their capacity to test the patients that come see them. And our emergency rooms are also increasing their capacity to test people that come to see them. I want to emphasize that only people who are sick need to be tested. And if you're not sick enough to go to the emergency room, call your doctor, and always call first before you go get tested. Always call first before you go get tested. They might be able to save you a trip because you might not need to be tested after they talk to you. We are also doing some testing. It's very limited to folks who fit in a high-risk category based on the Tennessee Department of Health guidelines. We also want you to call us before you come get tested. I think the governor is referencing some quick drive-through type testing facilities. We are working with some partners to look at how we might be able to do that here in Knox County. As you can imagine, there are a lot of logistics to making something like that happen, and a lot of partners having adequate supplies, being able to screen people who need to be tested versus people who just want to be tested. Again, if you're not symptomatic, you don't need to be tested for coronavirus or the flu or anything else. Only symptomatic people need to be tested, and symptoms, fever, cough, and sometimes shortness of breath, but fever and cough generally are going to get you tested for the flu maybe, or for COVID-19, depending on the rest of your story.
You mentioned fever there. What kind of degree temperature should people be looking for to say, okay, I might need to call?
The general rule of thumb that we use when we're talking about fever is above 100.4. So 105 and up. For adults, it's different for children. And I honestly don't have that off the top of my head. It's a little bit lower for children than it is for adults.
How many tests have been performed in Knox County so far?
You know, private providers are testing, hospitals are testing, we are testing. We're not able to keep track of all of those tests because not all of them are coming through our health department. We're not going to be giving out that information. We are not able to keep track of all the tests being done by private providers and others in the community that don't even come through the health department. Yeah, everybody's testing every day. We're working with providers to increase access in their offices. We're working with patients who are having trouble getting access, screening them, and offering them testing if it's appropriate through our system. Or we're also working on finding places that are testing, so that if you call us and we know where they're testing, we can send you there to get tested if that's appropriate.
So help us understand if it's a private, if it's a hospital versus you guys versus someone else, if they test and test positive, that information all goes to the state and it's released in the way we've seen it, so we don't have to worry about that.
Absolutely. We have a really great reporting system. It's an automatic reporting system through the labs. Now that COVID-19 is a reportable disease, like there are several other reportable diseases in the community and across the country, those test results go to the Tennessee Department of Health first, and then they come to us and to the provider as well. We'll be reaching out to those people who do test positive, educating them about what they need to do, how do they protect their loved ones and the people around them, and asking them a lot of very specific questions about their activities 7 days before they got sick, just like we do with lots of other infectious diseases that we investigate every year.
It's been said that a lot of patients might be asymptomatic. How can we know if those people need to be tested?
Well, I think if you look at the studies that came out of China, they didn't really find a lot of asymptomatic patients. They found people with mild symptoms. They didn't really find a lot of asymptomatic patients. And what we know about the science of disease and spread of illness is that you're most contagious. You shed the most virus when you're sick and have a fever. So if you don't have symptoms, you're not shedding very much virus because your personal viral load is not very high. And again, the studies in China really didn't reveal a lot of asymptomatic people.
If we don't have the number of tests that we're doing in the county, how are we supposed to evaluate the number of positive cases that we're seeing if we don't know the baseline number of tests?
Well, so knowing the number of people tested doesn't give us any idea of the level of disease in our community. The positive number helps us see what the level of disease is in our community, and right now that positive number is one isolated case. And I anticipate that will change, but right now we stand at one, and I want to give that context to our community that right now the risk to our general community is very low. And even the risk in East Tennessee is very low. The risk in Davidson County is a little higher than it is here, and risk in other places is much higher, but here in East Tennessee, the risk is very low for everyone.
This is a time of preparation. That's what we've seen from hospital leaders yesterday. Can you talk a little bit about changes people might see if they're driving by UT Medical Center? We're going to start seeing tents go up outside to help maintain overflow. Are we in this kind of initiation stage phase of the pandemic, if you will?
Well, all of our hospitals have plans, and we're talking with them. We're talking with them every day about things, working out the kinks and working out details. It's a great question for UT, how they plan to surge. What you're talking about is surge capacity, being able to see more people and house more people than they normally house. We'll be having conversations with them and executive leadership at each hospital, and probably ambulatory care centers, about how they increase their capacity to see more people. And each of those entities will make their own decision about how they manage their surge.
Last week you said that testing meant that you guys were just taking samples and then sending them off to the lab. Is that still the case?
Absolutely. We are not able, the health department does not do in-house testing. At this time, I'm not aware anywhere in the country of a point of care test where you take the sample like you do a flu test. You take the sample, you run it in your office. We don't have that yet. We might have it someday. Right now, all the specimens are being sent to laboratories, either a private lab or a health department lab. And right now, we're sending our tests to the health department lab based on criteria given us by the Tennessee Department of Health.
For those people who are testing negative, what kind of sickness are they coming up with instead?
There are lots of different respiratory illnesses out there that circulate this time of year. Flu, there's some things called adenoviruses. There are other kinds of coronavirus that aren't the new one, they're old ones. What we really hope is our medical partners are testing people for those more common illnesses. We have one case. Testing those people for those more common illnesses right now before they test them for COVID-19. It's things like flu, things like adenovirus and other coronaviruses as well. We're seeing some of that being done, but not everywhere. And it depends. Some of it depends on ability to test and what access they have.
You said that there's been no community transfer, obviously, since we only have one case. But if only people who meet the criteria that you laid out are being tested, how do we know?
Well,
I mean, for instance, if I have symptoms and I have COVID-19, but I don't meet the other criteria to be tested, I won't be tested for it, so you wouldn't know whether I got it from somebody at a restaurant.
well, actually, those folks who are being tested in private providers' offices do not have to go through the Tennessee Department of Health guidelines at all. Again, the Department of Health has limited resources, so we're limiting those resources for the people who are most likely to be ill. A private provider, if you have a fever and a cough and they believe you need to be tested for COVID-19, they can send that to a private lab and get that test result. We have several private labs in the community and in the nation that are able to test. And so based on the clinical presentation of the patient, the doctor or the nurse practitioner or the PA says, okay, you look like you have XYZ, we're going to test you for XYZ. And COVID-19 might be on that list, and they can send those to those private labs and get those results. Those results, again, the positives are reported to the State Department of Health and then reported to us for us to follow up.
One question we keep getting over and over again from viewers, and it's early because most of our viewers don't have it once yet if they're going to get it, but a lot of people are wondering, can you get coronavirus twice? Or is it the kind of thing your body builds an immunity to?
It's a great question, and honestly, I don't know that we have the answer for that yet. There certainly are some viruses that confer immunity, which is what we call that. So if you get it, you can't get it again. With COVID-19, I'm not sure we have that information yet.
With only one isolated case in Knox County, is a separate testing facility here necessary in your community?
I think that any way we can increase access testing to those who need to be tested is a good thing to do. And we have to look at all of those challenges and all of those logistics and decide, does it make sense for us as a community to do that at this time? It may be that we decide it's better to wait till later when we have a higher disease burden. And those are decisions we'll make with our partners and based on information.
Other pandemics that the health department and others plan for have multiple waves and take a while to kind of go through the system. Do you expect we'll see multiple waves of this?
We could. It's hard to say. Right now what we know is that the cases in China are going down. Are they going to go back up again? We don't know that until we see that. We also see, I think, that the cases in South Korea are going down as well, but we won't know that they're going to go back up until we see that happening. So it's not uncommon. We can't predict that. We haven't even, we've got one case, so we're very early in this pandemic in Knox County.
You discussed, you mentioned earlier that you have a plan, or you've been talking about two hospitals about plans for dealing with overflow capacity. You didn't mention what you're doing for counties that don't actually have a hospital in county. What specifically is being done to address the capacity shortage for hospitals that have or for counties that have no hospitals or very few hospitals?
So a couple things. One is we plan with Knox County hospitals. We do work with the region, but we don't plan with the region necessarily because our jurisdiction is Knox County. We know that the East region works with their hospital as well, but we all know that people from those counties that have limited access come to Knox County for their treatment and for their care, and they're still doing that like they always do.
And a question about
So it doesn't sound like the actual plan. Like, do you actually address what plans are in place, if there are plans in place?
Yeah, that's a great question for those hospitals. I can speak to the fact that we're working with our hospitals, and our hospitals already see people from the region, so they're planning on increase not just from Knox County, but from all over the region.
You mentioned Metro and state health department jurisdictions.
Sure.
I think that'll help
Sure.
clarify that.
Yeah, so in the state of Tennessee, there are 6 metropolitan health departments. Those are funded locally. We are one of them. So our funding comes primarily from Knox County. Across the rest of the state, the other 89 health departments are funded by the State Department of Health and divided into regions. The East region surrounds Knox County, and it's the responsibility of the folks that work at the East region to help those hospitals with their planning. We do work together with them, but we don't get involved directly. There's also a healthcare coalition that pulls together people from across the region to help with plans and coordination.
One other question that we've been getting a lot from viewers is we've seen the list of closings expand from schools to recommendations for restaurants, things like that. And we hear you say there's only one case here in Knox County. Why is everything shutting down when we only have one isolated case?
Well, some of that is because decisions are being made at the federal and state level that are then being given down to the local jurisdiction. And in part of keeping the message the same and following what the Tennessee Department of Health is doing and what the CDC is recommending, we are falling in line as well as a community. And some of those decisions are being made because across the country, the level of disease varies. And the federal government is making decisions based on the information they have. The State Department of Health is making decisions based on the information they have. And we do try to be in lockstep with them so that it's clear to citizens that we're all working together and we're making these decisions, we're following what the Tennessee Department of Health is recommending.
So is that to say that maybe we don't really need that in this area necessarily?
Maybe you don't really need what?
Is
Sorry.
there kind of closures and recommendations for no more than 10 people, things like that?
Right. So right now, what has come out from my office and others are recommendations for limiting social interactions. Making those recommendations early, we know will decrease illness, and so those are recommendations, not mandates. When we think about going out to eat, my advice would be if you're concerned about eating out in a restaurant, there's always takeout or drive-through or pickup or whatever delivery that you can get if you want food from a restaurant. If it's a concern for you to be in a restaurant,
We talked yesterday a lot about flattening the curve. This is part of that.
it certainly is.
What about
I'm sorry, I'm not able to.
What should people do who don't have a fever but they are really sick? Should they still go to the doctor's office or should they call ahead?
People who don't have a fever and are really sick and feel like they need to be seen by their doctor should call their doctor or call the ER, either one. It's best to start with your doctor. They know you best. And if they can get you in and see you, it's best to be seen by them. They're more familiar with your medical condition.
The
Absolutely. Always save the ER for emergencies, no matter what's going on in the community. The emergency room is for emergencies only and not for a slight sniffle or a slight cold.
What about at-risk populations, like the homeless population? What kind of guidance are you giving to the service providers that deal with them?
So, a couple different things. One, we know that our service providers all have infection control plans, and we've asked them to look at those and familiarize their staff with those plans. We also have activated the EOC, and as part of the activation of the EOC, they are helping focus efforts on the social services piece of this response. Thank you.
One thing we've seen in other communities as well is first responders often the first to come into contact with when they're helping other people, which can then burden the system further on as the virus spreads. How are we protecting first responders here in Knox County? What advice is the health department giving?
It's a great question. And first responders do come in contact with numerous infectious diseases in their day-to-day work. I know they met with our staff earlier today, and we meet with them regularly. They all have infection control plans. They're very well versed in protecting themselves against infection. This is droplet spread, meaning coughed or sneezed out, droplet in contact. So all they have to do is wear a surgical mask and a gown, and they have those, and gloves, and they have those supplies. We're also working to try to make sure we can get access for them for testing if someone does become ill, so that we can test them and know that they have it or they don't have it, and either isolate them and do what we need to do or recommend other options for them as well.
What are your current recommendations for senior citizens in Knox County?
Currently, my recommendation for senior citizens, and especially senior citizens with a chronic disease, we know that not all 60-year-olds are exactly the same. So senior citizens with a chronic disease, really be thoughtful about going out. And really consider whether you want to put yourself at risk of getting sick from lots of other things in addition to COVID-19. So be thoughtful about that. And family of older folks, my recommendation is if you're sick, don't go see grandma. Give her a call, send her a text if she can text. My dad can text, or whatever. But don't go see her. You don't want to make grandma sick.
I had a question about social media's role in all of this. I'm sure we've all seen a lot of spurious information, bad information, no information at all. How does that make your job more difficult in informing the public?
Well, so social media is, like I said all the time, it's a blessing and a curse. It is a great way for those of us who have reliable information, like the CDC, like the Tennessee Department of Health, like the Knox County Health Department, to get reliable, truthful information out there and get it shared. So what I'm asking your viewers to do and ask all of you to do is reshare our tweets, reshare the things that we put out there. But it's also a way for people who don't have the most informed information to put things out there and get reshared. And one of the challenges is the factual information isn't always as exciting and sexy as the non-factual information. So really share that factual information so more people can see it. That's going to help all of us and help really calm people down. People really trust what they see on social media, and when you're looking at social media, obviously you want to look for a reliable source, CDC, Department of Health, or the Knox County Health Department.
Are you seeing an increase in the health department of people presenting with symptoms of the virus right now?
So we don't do any primary care, so we don't have people presenting to us for care. So mostly how we get folks who come in to get tested is in a private office who maybe isn't up and running with testing yet, or maybe the patient doesn't have insurance or something like that. So we're kind of trying to stand in the gap until those things can get solved at those offices and provide services for those folks. And we're testing people daily.
You said yesterday we're at low risk here in Knox County. It feels like with one case we're still at low risk today. Do you anticipate that changing? Do you anticipate us getting to the level of community spread?
I do anticipate us getting to the level of community spread, but we can all slow that down by doing some social distancing, staying home if we're sick, thinking about whether you should go out, limiting your exposures, covering your cough, trying to avoid touching your eyes, nose, which I actually just touched my face, trying to avoid doing all of those things will help protect all of us. Staying home if you're sick is really important, not just with COVID-19, but regardless of what your illness is. We don't want you coming to work and making other people sick, so we also want employers to look at their leave policies to make sure people can stay home if they're sick.
What is the protocol for notifying someone if they might have been in contact with someone who is infected? Like, for example, the one patient we did have last week, they're on a plane. Do you contact everyone else on the plane?
So we use the science of epidemiology to decide who's at risk for being exposed to an illness. We do this with tuberculosis and STDs and lots of other things. So we start with the household contacts because they have the most contact with that person, and we reach out to them and tell them what to do to protect themselves. Sometimes we have to vaccinate, not with COVID-19, but sometimes we offer vaccination to reduce the risk of getting sick. And tell them what to do about, how long they need to stay home, what symptoms to look for. And then we take that really detailed history from the case and want to know, like with COVID-19, we're going back 7 days from when they first got sick. And we want to know everywhere they went and who they were with and how long they were with them and lots of details. And we will reach out to those folks and we simply say that they've been listed as a contact to a case. And it's up to that case what they tell their friends or family or anyone else. And we educate them and give them guidance on what they should and shouldn't do. And then depending on their risk level, the risk assessment, they're put into quarantine, either self-quarantine or quarantine where we're calling them regularly. And there are different levels based on that risk. And again, it's something we do regularly. It's not new for us. We're not having to make this up. We've been doing it for a long time. We do it regularly with tuberculosis and other infectious diseases.
Do you want to talk specifically about infectious disease on planes?
Oh, sure. So, you've heard a lot about airplane travel and people who have COVID-19 who've traveled on an airplane. The interesting thing about airplanes is they actually exchange air pretty fast. And so based on science and based on the fact that this is a droplet spread illness, it's only certain people within about 6 feet of that person who are at risk. Droplets don't travel further than 6 feet. They fall to the ground. So people within 6 feet of that person on the plane are the ones at risk. We will get that information from the CDC and reach out to those folks if they're people who live in Knox County.
And if one person in the household is quarantined or isolated, should the whole household also be quarantined or isolated?
So that really kind of depends on the situation. So isolation is when we know somebody is sick, and there are guidelines set out by the CDC and the Tennessee Department of Health for managing those household contacts. Quarantine is if you've been exposed and we're watching and waiting to see if you're going to get sick. And when you're not symptomatic, you're not any risk to your family members. So we might ask you to stay home, and maybe limit your contact a little bit just until your quarantine period is over. But your family can go about their business. They pose no risk to anyone else because they haven't been exposed. You're not a case yet.
I think I speak for a lot of us who are beginning to businesses are moving to work from home policies and trying to kind of do social distancing even in the workplace. Is that a recommendation that the county health department has now or anticipates having sometime soon?
Well, if we look at the CDC recommendations for workplaces, again, those are tiered based on risk. And so if you look at those, we're kind of in that planning phase of thinking about making sure your people can work from home. We're not a community spread yet, so we're not recommending, if people can telecommute and that works for their employer, that's great. Employers can make those choices. But based on that CDC guidance, again, it's kind of tiered based on risk in the community.
What do you know about the non-FDA approved, the former Ebola treatment that they said is actually kind of working for COVID-19 patients?
But yeah, really not our area of expertise, testing and trials for antivirals or vaccine. What I can say is lots of people around the world are working on trying to find a solution and a treatment and or a vaccine for COVID-19. But that's happening in laboratories and places where they have scientists who focus, that's what their job is.
Probably have time for one more, guys.
Is there any area that, we've seen the economy have impacts, we've seen hospitals begin to plan. Is there any area that you can say this is impacting, a health department service in a way that others haven't heard about? Or there's another aspect of our community that's being impacted by this that maybe hasn't gotten enough attention?
Wow, that's a great question. I mean, what I can say about currently, based on our situation, we continue to provide services at our usual level of services, family planning and STD testing and treatment and tuberculosis and immunizations and stuff like that. Our plan includes a reduction in those services based on how many people we need to mobilize, whether people are sick and we don't have workforce there. So we've looked at our plan, all of our departments have reviewed that plan, and we're comfortable with scaling those back and being able to offer services in an alternative fashion so that women can still get their birth control pills and moms can still get their WIC vouchers for their children.
When we get to that point, we will make announcements.
Absolutely. When we get to that point, we will inform the public and the folks that we serve. People get birth and death certificates and many other things from us. That we have plans to offer those in alternative methods. Thank you.
very much. We
Thanks.
appreciate your
Yep.
time.
Thank you. And thank you. Are you frozen?